Fever, body pain, low platelets. Most people immediately assume it's dengue, but here is the truth. Not every fever with low platelet is dengue. Several serious infections can mimic it, and missing them could delay proper treatment or even turn fatal. Let's break down the key dengue-like illnesses and how to differentiate them simply and clearly. So first, dengue fever, the classic one. So it starts with sudden high-grade fever, severe body pain and bone pain. That's why it is called as breakbone fever. Patients often have a headache, pain behind eyes, that is retroorbital pain, and sometimes a red rash on the skin. As platelets fall, bleeding may occur from the nose and gums. Red flags include persistent vomiting, abdominal pain, low blood pressure, or fluid leaking into chest or abdomen, that is effusion or ascites. To confirm dengue, first 5 days NS1 antigen or RT-PCR, after 5 days IgM antibody will appear. A CBC will show low WBCs, drooping platelet counts, and rising hematocrit. Mild liver enzyme elevation is also common. Number 2 is chikungunya. The fever and rash can look like dengue, but here is a big clue. The joint pains are much worse, sometimes disabling. Patients often complain of painful and swollen joints that can last for weeks or months. Platelets usually stay normal. We confirm it with RT-PCR initial days or after that chikungunya IgM. Third one is leptospirosis. This comes from exposure to floodwater or sewage. Very common during monsoon season. Fever is accompanied by severe calf muscle pain, jaundice and redness in eyes. If untreated, it can cause kidney and liver failure. Tests include leptospira IgM, elevated creatinine, high bilirubin and sometimes mild thrombocytopenia. Number 4 is scrub typhus. This is often missed unless you look for it. It is caused by mite bites, especially in rural or forested areas. The fever is typical high grade and patient may have a black scab called eschar along with rash, headache and multi-organ involvement. Platelets may also drop and liver enzymes go up. Scrub typhus IgM helps to confirm it. Next one, very important, is malaria can also present with fever and chills and low platelets, but most dangerous form, falciparum malaria, can affect the brain or organs. You may not always see typical cyclical fever pattern. Peripheral smear and rapid malaria test are essential. Number 6 is typhoid fever. It is also known as enteric fever. This causes step-ladder pattern fever, abdominal discomfort and either diarrhea or constipation. Relative bradycardia is a classical clue. Blood culture and typhoid.IgM are usually diagnostic. COVID and influenza can also confuse the picture. They can cause fever, body ache, fatigue, but usually with sore throat, cough or cold-like symptoms. COVID testing and flu swabs are help here.